Hi, Dr. Darrow. We are talking here in Randburg in Johannesburg at the Independent Audiological Network Summit. And you came all the way from Massachusetts to deliver a very special educational message.
I traveled far, and I will travel wherever I can to spread the message about the transformative medical treatment of hearing loss and tinnitus and how it's transforming lives by improving quality of life, reducing tinnitus, and potentially reducing the risk of cognitive decline and dementia.
So if I experience hearing loss, it could be indicative of many other things.
It can be. It can be the start of many things going on. What's really important is to not think about do you or don't you have hearing loss. I think it's more important to think, are you struggling to hear and follow a conversation when there's background noise? Do you have any ringing in your ears, even if it's only late at night when you lay down? These are signs that hearing loss is beginning. And like every medical condition, the earlier you catch it and treat it, the better the prognosis.
For eyes, we sort of are at ease with knowing that we should have eyes tested every second year, but there's no such a thing for ears.
Well, it's it's a great point to make. The American Academy of Otolaryngology has recently put out a statement that your first hearing test should be at 50 years old. And if it is determined that you have loss, that you should definitely start treatment as soon as possible.
So hearing loss doesn't start at 60 or 70?
No, actually hearing loss starts in the third to fourth decade of life. So if you're in your 30s or 40s, that is when it begins, and for most it becomes symptomatic when they turn 50 or 60. And so early treatment, like any medical condition, is very important.
And you classify it as a progressive degenerative disorder. That's neurological.
Yes, so hearing loss is a neurologic disorder. It's actually the number one neurologic disorder on the planet. And so what we've really uncovered and come to understand about what happens in the ear and the brain is it's not just about some cells in the ear that get old. It's really about the loss of neural connections from the ear to the brain. And that's how it can impact everyday life. It can impact memory. It can impact your mental health. It can really, hearing loss can have a devastating effect on you as you get older. Not for everyone, but for many people it can. And so it's really important to diagnose it early and to start treatment as early as you can.
We talk about tinnitus, tinitis. What exactly does that mean?
Look, tinnitus is a brain thing. Tinnitus is your brain creating the false perception of sound that isn't there. And what all the science is pointing to is that tinnitus is the result of a breakdown of the nerves that connect the ear to the brain. And when that happens, the brain essentially goes looking and making and creating its own sound. And so it's really important to not ignore the ringing, but to address it as early as possible.
Would you say that it's similar to having lost an arm? And
yes,
the brain still feels the arm?
That's a great analogy. Phantom limb, phantom sound. They are very similar.
Now, the number one factor for hearing loss is age.
Yes, your age is the number one relatable cause of hearing loss. Now look, as mammals, as we age, we lose our hearing. But what happens is, with some extra noise exposure, maybe a rock concert or two, medical treatments, say different medications, other medical disorders like heart disease and diabetes and a history of smoking, all of these can contribute and make that underlying age hearing loss even worse.
There's a term that refers to hidden hearing loss. You have your own translation for that.
Well, hidden hearing loss is essentially, that term came about in people who have difficulty hearing in background noise, people who have tinnitus, people who have some, changes in memory, but the hearing test seems to be normal. Well, what the scientific community has sort of coalesced around in the last decade or so is this is what we refer to as subclinical hearing loss. So it's really the earliest stage of hearing loss. Think of it, if you think about cancer, there's now a stage 0 cancer, sort of like the precancerous, right, when it's about to turn to stage 1. And so think of it as just an early stage, which it's really important to try to catch it then and treat it.
Okay. How does hearing loss relate to dementia, Parkinson's, and maybe dizziness or unsteadiness?
Well, look, so remember what we said. Hearing loss is a neurologic disorder. And the presence of one neurologic disorder can increase the risk of another neurologic disorder. What we've learned in the last 5 to 10 years is that hearing loss is not directly related to cognitive decline. Rather, hearing loss has the ability to impair cognition, impair memory, impair the way the brain operates. And these impairments can therefore increase the risk of developing cognitive decline and dementia. So there's no straight causal link. It's more you're at increased risk of developing cognitive decline and dementia with untreated hearing loss.
So the idea that if I experience hearing loss and I go to the doctor or the audiologist, they're going to give me a little pink thing to put in my ear and I will be able to hear again is far from the whole truth.
If it were only that easy. That's not true at all. So essentially, right, what we're doing is we're treating a major medical condition. And last I checked, there is no easy way to treat any major medical condition. So step one, find the right audiologist. And I can't recommend enough any audiologist in the iCAN network. Step two, go through the right diagnostic process. And step three, discuss treatment options with your audiologist and understand what your options are and choose what's best for you, for your hearing, and for your brain.
Thank you, sir.
Okay?